goal of this presentation is to compare ultrasound with other assessment techniques such as MRI and arthroscopy. If we're going to assess the musculoskeletal system on a structural level, we can choose several medical imaging modalities, like for example ultrasound, MRI, X-ray and CT. According to Tan et al. And many other articles, ultrasound and MRI are the most interesting techniques for the imaging of soft tissue structures. Let's have a look at the advantages and disadvantages of ultrasound and MRI. In terms of cost, ultrasound is much cheaper than MRI. Ultrasound is not only cheaper to purchase, but it's also much cheaper to use. The ultrasound system itself is of course an investment, but once you have it, you will only incur some electricity costs, and perhaps you might want to update the software after a few years. When considering the increasing healthcare costs, the low cost of ultrasound makes it an interesting modality to reduce the burden for both society and the health insurance companies. The low price also makes it an interesting business opportunity. Ultrasound is much more accessible than MRI. In many cases, ultrasound is also portable, so you can take the system with you to your patient or client if needed. Or you can easily manoeuvre the ultrasound system around the patient on its trolley. Once using it, you're not only limited to the area of initial interest, as you are with MRI. If you're performing an ultrasound exam of the shoulder, and during the exam you think it might be an elbow problem, you can very easily move from the shoulder to the elbow within a second. This is not possible with MRI. The most important advantage of ultrasound compared to MRI is the possibility to make functional real-time scans. Combine the clinical examination with the musculoskeletal ultrasound as much as possible and see what actually happens with the soft anatomical tissues during movements and provocations. This very functional assessment improves diagnostic accuracy and clinical relevance. Both MRI and ultrasound are very safe methods of medical imaging without any damaging or ionizing radiation. You can always use musculoskeletal ultrasound. However, in some cases, we suggest to work with the ALARA principle when scanning with ultrasound. ALARA is an abbreviation for as low as reasonably achievable, meaning that there are no contraindications, but in certain cases it's better not to scan that particular region more than is medically absolutely necessary. This applies to, for example, malignant tumours, bone fractures and pregnancy. The only disadvantage of ultrasound compared to MRI is that ultrasound is highly experience dependent. So ultrasound is difficult to standardise. It has many possible equipment settings and requires lots of experience and practice. Please realise that ultrasound is not profession dependent. All musculoskeletal healthcare professionals can learn musculoskeletal ultrasound as long as they meet certain criteria. These criteria will be explained in another presentation. The advantage of musculoskeletal ultrasound compared to an arthroscopy of a tendon, for example, is that with ultrasound you can see the status of the internal architecture. This is of course not possible with an arthroscopy. Patients actually prefer ultrasound examination to MRI. They say that MRI is very loud, it requires that you're not claustrophobic, and you're not able to move during the exam. Furthermore, it requires the removal of metals and makeup, etc. In general, ultrasound is regarded as being more patient-friendly. The first important key message of this presentation is that you should not make any hard statements, not to patients and not to colleagues, until you have sufficient experience. Research has shown that you have to make at least 100 to 200 scans per anatomical tissue before the diagnostic accuracy is satisfying. 200 scans sounds like a lot, but if you scan this particular tissue 20 times per week, then within 10 weeks you've met the criteria. If you only scan 4 times a week, it will take you 50 weeks, almost a year. So practice, study and learn, preferably on a daily basis. Ultrasound is a wonderful adventure which will enlighten you more about functional, three-dimensional anatomy and biomechanics. It will make you smarter and more critical. You will know much better what you can treat and what you can't treat. Your success rate will increase because you will only treat those patients who you can actually help. Lifelong learning is essential in musculoskeletal ultrasound.